I'm Neelam Phalke. I am a facial plastic surgeon at SIU Department of Otolaryngology. I'm from Las Vegas, Nevada. I was born and raised there. I went to college in LA at the University of Southern California, and then I went back home for medical school at the University of Nevada. And then I did my residency training at LSU New Orleans. I did my fellowship training with Dr. Michael Godin at Virginia Commonwealth University, formerly known as Medical College of Virginia in Richmond, Virginia. Fellowship trained in facial plastic, aging face, and cosmetic surgery, as well as trauma and reconstruction. So primary things that I love doing are things like facelifts, eyelid surgery, neck lifts. And then the other half of what I do is on the same spectrum, but in a different way, and that's trauma reconstruction. So primarily treating people with facial fractures, but also treating secondary issues from older traumas, whether that's scarring or dysfunction of structures of the face, like breathing or chewing or eating, and trying to get back our patients to what they felt like and looked like before they had whatever traumatic experience happened. Biggest sense of fulfillment I get is when I get to see my patients in clinic and they say that I've helped them in some way, even if it's that I haven't been able to do anything for their specific complaint, but was there to be able to listen to them and direct them to the right person to help them, or if I was able to help them. And I think what's really great about being here is the time and opportunity I have to get to spend with patients and be that person for them, whether as their surgeon or just as like a coordinator to help them get to the right person. Something that I'm super passionate about is facial trauma. I think there's so much important nerves and function in the head and neck area that can be really impacted by facial trauma, even if it's not something that needs surgery. And so I'm always open to seeing patients, even if they're told their facial fractures don't need anything done. The other thing is scars. A lot of times when you come into the ER because you fell or were in an accident and you have a scar, the first answer is, I don't care how it looks, I want to get out of here or make it okay. But then long term, that scar's on your face, it's not on your arm, and it's something that you and everyone else sees. And I think it's really okay to want it to not be there, or to want it to look less obvious. And that's something that I also really feel passionate about being able to help patients with and take care of, because just because we had an injury or went through something traumatic doesn't mean it needs to be presented on our face for everyone to see.